Hello, this video will discuss the different assessment methods for measuring flexibility in younger and older populations and also which body segments are being assessed. The assessment methods being used are the Canadian Trunk Forward Flexion Test, the YMCA Sit and Reach Test, the Chair Sit and Reach Test, and the Thomas Test. It is important to keep in mind that each assessment is performed twice, but the best of both scores will be taken as the measurement. However, it is only shown once in the video. The equipment needed for assessing flexibility is a flexometer, tape, a yardstick, a ruler, and a chair. Now I will discuss the protocols for the Canadian Trunk Forward Flexion Test. The test will measure the hamstring and lumbar flexibility. However, before testing, the participant should perform a 5-minute aerobic warm-up followed by a few light stretch exercises. The participant will sit with their feet flat against the flexometer without shoes at the 26 centimeter mark, and the inner edges of the soles are placed within 2 centimeters of the measuring scale. As the participant reaches forward, they will exhale and hold the stretch for 2 seconds while keeping both hands even. It is important that the participant's knees are not bent to skew measurements. Now I will discuss the protocols for the YMCA Sit and Reach Test. For this test, the proper protocol is by placing a yardstick on the floor with a piece of tape placed across the 15-inch mark. The participant sits with the yardstick between their legs with the heels of the feet spread 10 to 12 inches apart, touching the edge of the tape. Similar to the Canadian Sit and Reach Test, the participant will exhale as they reach forward, being sure to touch the yardstick and hold for 2 seconds, keeping their hands together with the knees straight. The test will also measure hamstring and lumbar flexibility. Now the chair, sit, and reach test will be explained. This test is appropriate for measuring flexibility in older populations. The chair must be 17 inches in height and there is no need to remove shoes. For this test, one leg is extended with the foot in dorsiflexion while the other leg is flat on the floor, keeping the head in neutral alignment. Exhale when reaching forward and hold for 2 seconds. The test is scored in inches with space between the big toe and fingertips is a negative score if the fingers do not pass the big toe, a positive score if fingers pass the big toe, and a score of 0 if toes are touched. The final test discussed is the Thomas test. This test measures hip flexor flexibility. The participant will lie in supine position and bring their leg to their chest while keeping the other leg straight on the floor. If the straight leg remains on the floor, the hip flexors of that leg are considered flexible. This test is done on both legs and is scored as flexible or non-flexible. These are the tables for the Canadian Trunk Forward Flexion Test and the YMCA Sit and Reach Test. Depending on the score of each test, the proper classification category can be chosen. For the forward flexion test, the classification was excellent because of a score of 40 centimeters. For the YMCA test, the classification was average because of a score of 18 inches. This concludes the discussion of the different assessment methods for measuring flexibility. Thank you for watching.